Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Niti Aayog releases SDG India Index and Dashboard 2020-21. Supreme Court asks Centre to furnish detailed data on purchase history of COVID vaccines. Centre issues advisory to states, union territories to issue ration cards to most vulnerable and economically weaker sections of the population. An NPCC asks Health Department to substantiate claim of Finance Department on funds incurred on COVID-19 pandemic. In the wake of COVID-19, we appeal to our listeners not to lower their guard and stay safe and protected by following these 4 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene, and get vaccinated. For providing COVID-related information and guidance to the people, national helpline numbers 011-2397-8046 and 1075 and state helpline numbers 700-5539-653 and 1800-345-0019 are operational. Now the news in detail. The third edition of the Sustainable Development Goals SDG India Index and Dashboard 2020-21 was released by Niti Aayog today. Niti Aayog Vice Chairperson Dr. Rajiv Kumar launched a report titled SDG India Index and Dashboard 2020-21 Partnerships in the Decade of Action in the presence of Member Health Dr. Vinod Paul, CEO Amitabh Kant and Advisor SDGs Sanyukta Samadar. Speaking on the occasion, Dr. Rajiv Kumar said, "Our effort of monitoring SDGs through the SDG India Index and Dashboard continues to be widely noticed and uploaded around the world." He said it remains a rare data-driven initiative to rank our states and union territories by computing a composite index on the SDGs. CEO Amitabh Kant said, "With 1/3 of the journey towards achieving 2030 agenda behind us, this edition of the index report focuses on the significance of partnerships as its theme." He said the report reflects on the partnerships we have built and strengthened during our SDG efforts. According to the report, the country's overall SDG score has improved by 6 points from 60 in 2019 to 66 in 2020-21. The positive stride towards achieving the targets is largely driven by exemplary countrywide performance in clean water and sanitation and affordable and clean energy. Top states in the index are Kerala, Himachal Pradesh, Tamil Nadu, Andhra Pradesh, Goa, Karnataka, Uttarakhand, Sikkim and Maharashtra. Mizoram, Haryana and Uttarakhand are the top fast-moving states. While in 2019, 10 states and union territories belong to the category of front runners. 12 more states and union territories find themselves in this category in 2020-21. Uttarakhand, Gujarat, Maharashtra, Mizoram, Punjab, Haryana, Tripura, Delhi, Lakshadweep, Andaman and Nicobar Islands, Jammu and Kashmir and Ladakh graduated to the category of front runners. The SDG India Index computes goal-wise scores on the 16 SDGs for each state and union territory. The Supreme Court has asked the Centre to furnish detailed data on the purchase history deal date of all COVID vaccines, including Covaxin, Covishield and Sputnik V. It also asked the Centre to place on record all relevant documents and file notings reflecting its thinking, culminating in the vaccination policy. A special bench of Justices D.Y. Chandrachud, L.N. Rao and S. Ravindra Bhatt said, while filing its affidavit, the Union of India shall also ensure that copies of all the relevant documents and file notings reflecting its thinking and culminating in a vaccination policy are also annexed on the vaccination policy. The bench has directed the Union of India to file its affidavit within 2 weeks. The bench said this in its order of 31st May, which was uploaded on its website yesterday. The Centre has issued an advisory to all states and union territories to launch a special drive to issue ration cards to the most vulnerable and economically weaker sections of the population. The step has been taken in view of the difficulties faced by the poor people in obtaining a ration card due to COVID-19 pandemic crisis in the country. The Department of Food and Public Distribution has urged the states and union to utilize the available coverage under their National Food Security Act (NFSA). The operational responsibilities like identification of eligible persons and households under NFSA and issuance of ration cards to them rests with states and union territories. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on a YouTube channel, AIR News Kohima. Nagaland Pradesh Congress Committee (NPCC) has asked the Health Department to substantiate a claim of Finance Department made on details of funds incurred on COVID-19 pandemic. In a press release, NPCC President K. Tere pointed out that a clarification made by the Finance Department indicating 245.44 crore rupees spent on the pandemic is big money for a small state with only 12 districts. He therefore said the Health Department should bring out the district-wise utilization report indicating work and supplies. Terry also said public funds should be spent with transparency to secure lives and not on expensive infrastructures to profit. The NPCC president said just financial figures do not prove any benefits to the people. Deputy Chief Minister Y. Button today donated an ambulance to the District Hospital Dimapur in the presence of State Nodal Officer for COVID-19 Y. Kiketo Sema, CMO Dimapur Dr. Moa Demjan and others. In a tweet, Button said the ambulance was donated to the District Hospital Dimapur on the request of District Task Force Dimapur. Stating that it is a moment of joy and humility for his family, he believed that many precious lives will be saved through the use of the ambulance. The Deputy Chief Minister also expressed gratitude to the nurses, doctors and all frontline workers for their sacrifices during these tough times. The District Administration Mukokchung and Mukokchung Police have initiated a free ambulance services for COVID-19 related uses in Mukokchung. The ambulance service will provide free services to those needy patients seeking for emergency transportation from home to COVID-19 hospital Mukokchung. It will also cater to the needs of those who wish to be transported from the COVID-19 hospital or COVID care center to home, or those high-risk contacts needing to travel to the testing centers. Nodal Officer and SDO Civil Mukokchung, Sentilong Uzakam, stated that Mukokchung has been witnessing increase in COVID-19 casualty as many poor patients cannot afford to hire vehicles to go to the hospital, besides fear and stigmatization. He urged upon the citizens of the district to contact COVID-19 helpline numbers or seek medical support if they are witnessing COVID-19 symptoms at home. The free ambulance service will be limited to Mukokchung Municipal and other adjoining areas, and the helpline number is 9362 561 926. Union Education Minister Ramesh Pokhriyal Nishank has announced that the government has decided to extend the validity period of teachers' eligibility test qualifying certificate from 7 years to lifetime. This will be implemented retrospectively from the year 2011. The minister said the states and union territories will take necessary action to revalidate and issue fresh TET certificates to those candidates whose period of 7 years has already elapsed. He termed this a positive step in increasing the employment opportunities for candidates aspiring to make a career in the teaching field. And now it's 20 news. Here are the main points again. Niti Aayog releases SDG India Index and Dashboard 2020-21. Supreme Court asks Centre to furnish detailed data on purchase history of COVID vaccines. Centre issues advisory to states and union territories to issue ration cards to most vulnerable and economically weakest sections of the population. And NPCC asks Health Department to substantiate claim of Finance Department on funds incurred on COVID-19 pandemic. That is all we have in this evening news bulletin. Good night.